Actually, most all diseases are like the trunk of a tree that have a number of roots and a number of different causes that go together. I think 100 years from now, when we look back on the history of American medicine and put things in perspective, I think we'll realize that the last 30 years of this century was a time where we came to recognize that virtually all disorders are psychosomatic. Back when I was in college, I was taught that schizophrenia and manic depressive disease and alcoholism were what we called functional disorders, by which we hedged a bet a little bit and said, well, maybe someday we would discover a biological cause. But we really knew that they were psychological, and we had all kinds of psychological theories. And now we've realized with these diseases over the past 30 years that they all have biological components. Now, that does not mean that they're totally biological disorders. They're also related to child raising. They're also related to the mysterious kind of human soul that people have and the choices that people make. And diseases are a very complex kind of phenomenon. I think now also we'll recognize by the end of the century that cancer and heart disease are also largely psychosomatic disorders that, as well as having biological components, which we now recognize, that they also have psychological components.